Work plan for African Digital Health Library Nigeria, 2018 to 19. Where we are, current status of ADHL UI repository. Creation of communities and sub-communities done. Main community faculty done. Sub-committees done. Total 250 theses have been scanned, and of number of 160 theses have been added to the repository. Next. What next? Official launch of ADHL UI Nigeria. Officially, the launching will be organized by the University Librarian. From there, she will be the one to inform the general public, like the university management, on how to go about the launching, and also inform the other official in the policy enforcement, implementation and adoption of the policies on content submission, also access metadata, license withdrawal and preservation. The staffing, we have dedicated staff for metadata description, collection of content, sorting of content, scanning and editing of content. Marketing and promotion, marketing, promotion and advocacy. We are going to market and our products and the ADHL through the presentation to the university management, also presentation at the academic board, presentation at the research and development committee, university-wide presentation, workshop and promotional level, university newsletter, emails, websites, and all those stuff. The training, we are going to have regular training on staff from time to time, training of staff of scanning and print out documents, training and retraining of IR staff, training of the community and the potential users in the universities. Mentoring, training and mentoring library staff, mentoring of young librarians on how to scan and edit, then also input the data into the IR. Monitoring and evaluation. Monitoring of user, we are going to use user statistics to monitor the use and the rates of which they cite it on this. Review of usage of IR, evaluation, user assessment. In this regard, we mean that we are going to make up a kind of questionnaire for the end users for as a feedback to know what we need to do, how maybe they enjoy using our IR and all the stuff. That at the end of the year, we are going to make a report, though it's going to be a kind of quarterly report, but the final end of the year, by the year 2019, a final report will be out. So this is how we intend to get our documents scanned and the results at the end of 2019. By the first quarter, that is November to January, we are going to meet up with 300 copies on our IR. By the time February to April, that second quarter, we'll meet up with 600 copies in our IR. May to July, that's the third quarter, 900 copies of document in our IR. By August to October 2019, we have to meet up 1,200 materials, copies now, coupled with the one we have before. So this is the breakdown of how the work is going to be done. What will be done, responsibility, and the time frame. Officially launch the IR to organize an official launching of the ADHL UI project by University Librarian by November 2018. The policy approval, adoption, and enforcement. Approval and adoption of the IR policy will be by university management. By this time, they schedule it. Content collection, content of theses from the university library to the medical library. This will be the duty of Dr. Ajwon and other staff in the library. Populating the IR, scanning, editing, submitting, and uploading. This will be the work of the all IR staff ranging from October 2018 to September 2019. Review and approval, content review, QC and approval. Dr. Ajwon will be in charge of this by October 2018 to the end of the project. Then, marketing and advocacy. Presentation to the management, this will be the work of the university librarian. Presentation at the academic body, this will be the work of the medical librarian. Then, university-wide presentation, workshop, and promotional event, work of Dr. Mrs. Ajwon. The use of university e-bulletin, email, website, community, social media platform, IT staff. The IT people will be the one in charge of this to make it popular. They will publicize it through media. by ranging from October 2018 to September 2019. Training of staff on scanning of print documents, training and retraining of IR development staff, training of the community and potential user. IT staff, IR manager, and the PI will be the one in charge of this. And this will start from November 2018, January 2019, and March 2019. Monitoring, training and mentoring. This will be the work of responsibility of Dr. Grace Ajuwon. From October, young library staff for continuity. Also the work of Dr. Ajuwon, September 2019. It will move from October to September 2019. Mentoring and evaluation of the project. Collect usage statistic development and develop an evaluation questionnaire and collect feedback from end user. IT people will be in charge of this, and it will be taken quarterly. Report writing, report of progress, progress report. Dr. Ajuwon will be in charge quarterly. Then the final report by September 2019, also Dr. Ajuwon will be the one to take that.